All right, maybe 7 o'clock now. So, welcome to this meeting of the Health, Wellbeing and Environment Scrutiny Committee. Starting on our agenda tonight, item 1 is apologies. Do we have any apologies for this committee? Okay. Item 2, declarations of interest. Any declarations of interest? Councillor Fox, you.
Thank you, Chair. I'm in the employment of local authority fire and rescue services and fire brigade.
Thank you. Councillor Fox.
Yeah, I'm the Covenant member / County Council for Integrated Care Service Safeguarding the Public Health.
Thank you. Item 3 is minutes of previous meeting. Are we happy to accept the minutes of the previous meeting? Thank you. Yeah, that's accepted. So we'll go to item 4, which is District and Borough Health Scrutiny Activity, which is receiving feedback from members of this committee who attended the meetings of the Health and Care Overview and Scrutiny Committee. I don't believe there's any feedback apart from what's on the report here in front of us. So unless there's any comments on the report, are we happy to accept that report? Okay.
Yeah.
Okay then, so we go on to item 5, which is Wally's quarry food issues. So I'll invite Craig to introduce the report.
Thank you, Chair. This is your regular update report, members. Obviously, this is a report that's been issued to the Cabinet in April. So I'll just go through the headline themes and obviously take questions afterwards. So in terms of complaints, we saw an increase in January, reaching a peak in February of 1,431 complaints. A lowering of that into March, although we did see 20 odour events in March. Now, an odour event is where 10 complaints are received per day. So that obviously shows there's still a concern within the local community. That dropped to 5 events in April, but again, has risen to 15 in May. So you can see that there's a very much an up and down pattern of events occurring, reflecting the problems that still are arising from the quarry landfill operation. In terms of complaints, they tend to correlate well with the air quality data. And if you look at the graph on paragraph 2.22 in the report, you'll see that very much reflects that trend in January, February, and the early part of March. In terms of the legal situation, we have had reports that have been taken to council which show that the abatement notice previously served has been breached. And as a result of that, the council has asked officers to look into the possibility of legal action and what options are available to us. Now, as it says in the report, one of the concerns that we have as an authority is that we are not the primary enforcing body, that is the Environment Agency. And we would have to get permission from the Secretary of State to actually progress legal action. So we're taking legal advice on that and what our options are. And obviously we'll bring a report back in due course to you members with the results of that, as well as council. Again, looking at the trends, there was the suspension notice issued by the Environment Agency earlier this year, which caused Wally's Quarry Limited to undertake various actions. As a result of that, you'll have seen in paragraph 2.4, the graph there that shows, as a result of the suspension notice and actions taken, then there's been a reduction in complaints, which suggests that the suspension notice did actually seem to achieve, at least in part, what it was meant to do. The other thing we do need to take account of, though, is that there may be weather conditions that also impacted upon those complaints at that particular moment in time. So again, it's something that we have to monitor along with the Environment Agency. In terms of the KPIs, they're all listed in the report, in the appendices. And the other thing I want to add tonight was that the committee of inquiry that was agreed to be set up by council in February is in the process of being set up. We now have a member working group which is preparing for the 23rd of July committee inquiry day, and in due course we'll be inviting participants to come along to that and present their statements and to take questions from the members of the committee. Thank you.
Thank you. Any councillors have any questions or comments made on that report? Councillor Wilden?
Just a comment that a lot of work has already been done with that committee of which Councillor Adcock and myself are part, there's had to be a moratorium, and because of the surprise election dates have been put on us, because it has to be seen as not affecting anyone politically. But I'm just hoping that people understand that and don't think that we've abandoned a project, because it is ongoing and an awful lot of progress has already been made. Just a comment.
Thank you. Councillor Jones.
Thank you, Chair. I wonder if the officer could just talk us through a little bit about the best practical means. So my understanding with that is that the determinant of best practical means would be the Environment Agency that would determine whether that, am I wrong with that, first of all? And secondly, what kind of impact would the legal settlements on the previous abatement notice, where the council accepted that RED was undertaking best practical means, what influence would that have on this legal case?
Chair, I'm not the expert in this particular field. I'm standing in tonight for Nesta Bark, who's the Service Director for Regulatory Services. So I wouldn't attempt to try and answer that question without knowing the answer. And it's something which I will take away. But there are two issues here with regards to best practical means is one of the defences against the legal action, which Councillor Jones has quite rightly identified as the subject. We are seeking advice. We have King's Counsel advising us at the moment on what our options are and what the best approach will be to effectively prosecuting Wallace Quarry Limited. We would obviously take advice from the KC, and we would need to potentially consult with the Environment Agency. But of course, the Environment Agency are one of the courses of action that we might want to take action against if we feel that they are not doing their jobs properly. So we would need a degree of independence there, and that's why we'd be taking King's Counsel advice.
Yeah, Councillor Jones.
Yes, just quickly, Chair, could I ask that the outcome of the discussions with the Associated Director is circulated?
Yes, it does.
Councillor Fox Stewart.
Thank you, Chair. Just a question. In the event that in 5 weeks there is a new Secretary of State, does the application need to be resubmitted, or does the extant one simply continue through certain in regard to taking enforcement action against the operator?
Well, in the case of the response from the government, we have not received anything, so I suspect that it will be the new Secretary of State, whoever that may be, who will be in the position to respond, and we will obviously follow that up if we don't get a response between now and then.
Okay, any more questions, comments on this report? Can I make one, Ray? I appreciate you standing in for Nesta, but on 2.15, where it says about the correspondence from Wallace Quarry, I don't know if there's anything else you can answer that or shed any more light on it, where it says about employing practices that remain exemplary, which obviously we take exception to, and the fact they're claiming that there's no area identified as having impacted it or at the Wallace Quarry boundary. I wonder if there's any more light you can shed on the communications they had with us claiming this, but it was my understanding that they had accepted that they were causing a nuisance offsite.
Again, Chair, I think we'll have to take that question back to Nesta and bring an answer back to you. But I think obviously what the Wallace Quarry Limited are trying to do there is to, with respect, get them there first with their defence, just to I think they've acted so far, and what they would be suggesting their defence would be to progress legal action against them.
Okay, thank you. Right, so no more questions on that. Then we'll go on to item 6, which is J2 services to reduce child excess weight. I'd introduce the report. Thank you.
Thank you, Chair. So I was asked to bring a report tonight about children's weight and what we can do as a council to help in terms of J2. So I'm starting off with a bit of information that the County Council collated for the Better Care Health Partnership. In summary, the number of children who have excess weight or obesity is increasing in the borough. They take some statistics, particularly around the reception age and year 6 age groups. what they have found is that the figures for them two age groups are increasing. So it is a problem that we need to look at within the borough. And equally, the number of areas where children are getting excess weight is increasing. So at the last review of wards, we got Kidsgrove and Raisin, Ravenscliffe, Audley, Bradwell, Clayton, Crossheath, Silverdale, Westlands and Wolstanton. So that's quite a few of our areas within the borough. However, things do change and you do get peaks and troughs and that works in statistics, but overall I would say that it is an issue that we should note and take interest with. I'm happy to take questions as we go through the parts, or I'll carry on. Going back to headline, yeah. In terms of J2 then, so the J2 facility, as most councillors will know, there's kind of two sides to it. So there's the pool and the gym. In terms of children accessing that, from the gym side, it is 12 up. So you have to be 12 to use the gym equipment for insurances and just general knowledge of how to use the machinery. From the pool side, it's anything from pre-birth upwards. So from the swimming side, we do the baby bump classes, then we have the babies in and the toddlers in, then on to school age children and then adults. So from the pool side, we're open for any age. And in terms of swimming, we have generic swimming sessions that you can just come along to and use the pool as you see fit, or there are lessons. In terms of children's lessons, there's two different options. There are the school paid for lessons in the daytime, term time that school children attend with their teachers in their school. And then outside of school hours, there are parent paid swimming lessons. The report just outlines that we currently have 15 schools using our services, with an average 40 swimmers coming per school. And in terms of children learning to swim from parent paid lessons, we've currently got 976 on the register at the moment, coming regularly for swimming lessons. That's a very high level kind of summary of the two offers we've got for children in terms of the gym. In terms of things we're developing and moving forward, we've got some funding from the county councils from the Health Inequalities Grant funding. We've set up a referral programme called Active Life. This is basically to address health inequalities within the borough, and children can access Active Life for free, and they are entitled to bring a buddy with them. So if there is a young person that wishes to come to the gym, say a 13-year-old, they can choose to come with their parents or their friend. It's well known that if you want to start exercise, if you attend with somebody that you feel comfortable with, then you are more likely to continue. So that young person can come with the friend as many weeks as they want onto that referral programme. We have found that some of them are coming with carers, so we've got some interest from children in care, and the social workers or care workers are coming with them. A lot of the referrals and interest is coming from school nurses, because obviously they've got first-hand knowledge of which children they think would particularly benefit from this kind of offer. It is in its early days in terms of referrals, so we started taking referrals beginning of May, so we've only had 4 weeks, but we expect by beginning of July that we'll start to see a take up of that programme across adults and children. That's my high level summary. I'm open to questions because I'm not totally sure what the committee wanted to discuss. So.
Well, thank you. If there's any points people want to ask questions on or comments on. Yeah, Councillor Wright.
I just wondered, how are you going to measure the outcomes? Are you going to measure the outcomes? Is there a time scale, I don't think?
Yes, Councillor Wright. So the Boone County Council, there is a whole list of outcomes in terms of measurements. So obviously one with this will be weight. When people come through the Active Life programme, there's about an hour's consultation before they start. Go through all their health, any medication they're on, any illnesses they've got, any previous injuries they've got, and it's records their health now. They then do small samples throughout the programme and another survey at the end to see if they feel they've benefited or if there's actually some physical changes in, for example, weight. That's then reported over the year to go back to the county council partnership to see if they want to continue with this type of programme.
Councillor Fox Stewart.
Thank you. In terms of the active Lyme referral programme, just to become clear, where are the referrals from? Is it just local authority education sector, or is it GPs? Is it staff referrals? And further to that, how can members promote the programme more widely?
Thank you. Yes, so the system referral programme book, you don't have to be referred by a professional, you can self-refer. So that's the first one. People can go on our website and fill an inquiry form in and do it themselves. In terms of professionals, we've signed up the primary care network, the hospital, doctors, GP surgeries, we've say got school nurses, specialist groups like mental health, social prescribers. There's about 25 different agencies that are all aware and can refer. We are expecting that the majority of them will ask the customer themselves to self-refer to save the professional the time doing the referral. It doesn't make any difference to us if it's a self-referral or a professional referral. They can come through. And sorry, then on marketing, we've had some the Active Life brands of the new marketing. So all the health professionals have had the brochures, the posters, got pop-ups, a different part of the website set up for it. So the team are out promoting that, going to whichever event and health people would like us to attend.
Thank you very much for that. And in terms of self-referrals, then, is there a criteria like a medical guideline, BMI, or where is the criteria to be accepted onto the programme for the funding for the activities?
So there's two elements. For the children, it's all free. For the adults, some parts are chargeable. So if you self-refer, you can't have been a J2 member currently, because obviously all our members are just transfer onto the scheme. So first one is you haven't been or not currently a member. You then tick to say which health criteria you think you fit. They are fairly open, so nearly every kind of health condition is listed under different schemes. We might come to you and say, we don't think, or for instance, you're overweight, but we think from what you've said, you've got a mental health issue, so we put you in a different class. So there may be a bit of class allocation that will vary depending on what you fill the form in. If you fill the form in and you say you have potentially a problem paying, the charge is based on the national prescription for prescription charge, about £32 if you pay up front. We've done that based on what Cheshire have done, because they're a bit ahead of us. They found that if people pay a nominal fee, then they commit and attend, and then they're quite happy after the 12 weeks to continue because they already know you accept the charge. They base the fact that it's based on the prescription charges, what the government nationally have said is a reasonable charge. If, however, you live in one of the top 20% most deprived postcodes, then you can access it for free. Then postcards are on the website, so if you go through, you can check yourself, or a member of staff can check for you.
Councillor Builder.
And what's available and what you're doing is absolutely exemplary. And it's really good that it's available. But my experience from teaching is one swimming lesson a week isn't going to make a child of that. An excessive weight child fitter. It teaches them to swim. The other stuff, if there was anything wrong with the child, and I've done it myself, you refer them, or you statement them, or you say, you know, if it was to do with eyesight or hearing or that sort of thing. If you try to do that in the circumstance where the child is overweight through, and it's usually through bad diet, not all the time, but usually, it can be seen as too intrusive for the parents, and quite rightly so in some situations. So other than monitoring it and moving towards that facility, being able to refer saying your child is going to have serious health problems unless, I don't think you can do any more than just provide them and hope that someone takes them up. And getting them to do that is a bit like looking for hen's teeth, to be honest. But good on you for providing it.
Yes, thank you, councillor. In terms of the active referral, then if you pay and you go on that, you not only have access to your class, but you have then free access to the gym, so you can come as many times as you want. So, for instance, if the child does come once, then they can come again at the weekend with the dad or the mum, or if that's what they want to do. Most of the classes have a I'll call it a social chatty element. So part of the programme is depending on why they're there, is about people with similar health problems being able to share experiences. So a lot of, particularly like the falls prevention, and that is about people who've had a fall having a discussion with people in my group about, this is what happened to me, this is where my goal is, this is where I want to get to, and somebody else in the group saying, I'm 4 months ahead of you, this is where I'm at, and there is a peer support element built into that discussion part of the session. It isn't all just about lifting weights in the gym or how many lengths you do. It is intended that you make friends within the group of people with similar health issues.
I think you're doing whatever you can in incentivising and setting up competition, but I still think you're on for a struggle. Good luck.
Yeah.
Councillor Northcote.
Thank you, Chairman. Thanks for the report, Joe. I think this is a good step in the right direction. But as Councillor to the right, Councillor Will said that you're going to have a struggle. I just wondered if through talks with the staff at County Council, whether there's been any sort of mention of programmes to target parents, children who come into the active scheme for education purposes, even if it's just a leaflet to say, these are the health benefits, blah, blah. This is how you can help a child, portions of food, etc. Also, it's a trick that we could actually jump on board. It's not going to be the single magic bullet. There's going to be other things that's going to be in place in this. We've considered and we've heard about the local plan. We talked about health in all policies. We've also talked about health impact assessments for the local plan in terms of planning. But it's going to take concerted effort by everybody involved to take ownership of this. And it's not going to be one agency that's going to be responsible for health of children. And this is a step, an exemplar in the right direction in terms of start kicking that off. But I think there's more work that we could actually attach to this if we're clever, just a bit savvy, even if it sort of links to perhaps the social media campaign with it. I don't know. You guys are the experts, but I think it's a good opportunity to have those discussions with our partners. And yeah, great. Thanks. Thank you.
Yes, Chair. So in terms of the wider county partnership, there is a district-led task force working group at the corner, looking at excess waste across the district. That pulls together key partners and staff working in different agencies to contribute their element. So there is a working document and action plan being pulled together. That includes things like the time to support health eating. So that is where parents and children of school age, mainly primary school age children, can get advice on what to cook for tea, what junk food not to eat, how many chocolate bars you can have before school before it's not considered an appropriate amount. So they are more child-based learning and activities and fun-based education. Obviously the school nurses have got a whole raft of tools that they're working to get parents into healthy eating, and there's a whole action plan about food provided by schools. So what's offered to the children for lunch. Again, very difficult because You know, I know from my own child, he only eats one thing off the menu, doesn't matter what I say to him, he's eating a tuna sandwich and that's it. So yeah, there is a whole action plan that, you know, different partners are working on. Thank you.
Councillor Fox, you.
Thank you again, Chair. Just looking at, so there's a number of opportunities in the study. Is there specific provisions for those that have disabilities, or are they required as one-to-one? Is there extra provisions to put in place for that everyone to do that?
Thank you, Chair. There's a couple of things we've done through the Active Life. We're purchasing a new chair to get into the smaller pool. We had some feedback from families of disabled people to say the chair we used didn't meet every disability. I appreciate not all equipment fits every need. So we're all looking at a different chair to enable people to be lowered into the pool better. In terms of children's needs, our staff have training in how to help different needs. We do one-to-ones. So particularly, we follow the national curriculum in teaching each stage. And if a child can do 8 of the 10 things and has been in that class several weeks, then we'll say to the parent, right, we're struggling on item 9, let's have a one-to-one, and we'll just look at that 9th thing. And normally then 1 or 2 one-to-ones, and that child can normally grasp it with a bit of extra support. So that is available.
And just to follow up, you know, my Chair. Please don't say this is too much of a criticism.
Yeah.
A lot of these reports, it's customer practice on the quality impact assessment, say no impact assessment implications. Clearly, there's been some work done there around disability. So, for example, it'd be nice to see that wanted on to show the consideration of the standard report saying no implication.
Councillor Jones.
Thanks, Jay. Thanks very much. It's just following on from Councillor Fox-Hewitt's question, and it's good to hear that. I've got a lot of really good things there about those with additional physical needs. But what about those with very complex mental health needs, particularly those with ASD diagnoses who may struggle in a busy environment? Are there any plans to cater or to cater to those?
We've had conversations with a charity that's basically based around walking in water, and they focus on getting people with particularly the diagnosis you talked about walking first. So it's about them feeling comfortable in the environment, and very much about them being comfortable with the person they are with. So that programme works on a volunteer basis, who's obviously knows all about people's needs, but also the environment in the pool. So they normally come from a swimming background. And then after that person's done weeks or months of walking in water, and they timetable them sessions at quiet periods, just because of the points you raised, then they will say, right, if you feel comfortable, let's now try a swimming session. So that programme is available. The pool is generally quite busy, and it is generally quite loud when you've got a lot of children in. So as you can imagine, 40 young kids from the school, and they do make quite a bit of noise. So yeah, we have picked out the walking sections, after school sections and quiet parts of the week. But it is a big building, and there are a lot of people in it.
Councillor Wheeldon.
Can I extend my personal thanks to the people who warm that little pool and have easy access, because following a broken back and a replacement hip, that place actually got me walking relatively normal again. And the temperature is so critical when someone's had an injury or they've got an infirmity at all. And it's just a magic place that gets you moving again, and you actually feel less vulnerable. So would you pass that on to the team that do that? Thank you very much.
I've got a question on J2. I used to take my classes there, go to J2, and I know one of the biggest losses during the COVID pandemic in education was swimming lessons. It was one of the first things to chop, and one of the last things to sort of return to normal. I've got kids I taught years ago who still aren't very confident swimmers because they missed out that crucial stage, and I know schools that have had like a mobile will come out and they're trying to catch up on all the swimming lessons. And just wanted to ask you, in 15 schools using the service now, is that generally an increase, and is it at capacity, or is there scope to increase the provision for school swimmers?
So we're not at capacity, we can take more schools. One of the big hurdles is cost of transport of coaches. So for instance, all the schools that have access to, they're either their own school bus or part of the academy they are part of as a coach or a coach link, then they are more willing to bring children regularly out in them coaches. And we've got a couple of schools that walk as well. There's definitely an increase in numbers of schools not supporting weekly swimming. And they are, for instance, meeting their minimum quotas by having an outdoor pool and schoolyard so many weeks in the summer months. But you are right, the regular attendance then isn't there, and then children aren't progressing as quick as they would, and they are reliant on parents for fulfilling the gap. But yes, if more schools are interested, we can accommodate them.
Okay, thank you. So let's send more questions on that one. We will say thank you for your report, and we'll move on to item 7, which is Chief Fire Officer update. You might recall we asked for an update to be provided by the Chief Fire Officer on the 3-person crewing trial that we discussed back in September. Also lucky to have our police, fire and crime commissioner here with us this evening. So I'll hand over to them to introduce their report. Thank you.
Thank you, Chair, and good evening, committee. Thanks for the invite to come back and speak to you this evening. As you know, we briefed you last year following the introduction of the new approaches to crewing our on-call fire appliances, and that came after a number of concerns had been raised, and we had a good debate in this very room and went into the detail of what the trial was trying to deliver. As stated last year, our aspiration is to have a minimum of 4 riders on on-call appliances and a minimum of 5 riders on whole-time appliances. But when those crewing levels dropped, we previously took the fire engines off the run and they weren't mobilised for operational incidents. We tried to look at a different way of using our resources that are available in the most efficient way. We have been challenged by His Majesty's Inspectorate for Constabularies and Fire and Rescue Services to do everything that we can to try and improve the availability of our on-call appliances. And this approach was developed with the aim of ensuring we would use the available resources in the most efficient way we can. We've challenged ourselves to do everything that we can to recruit and, more importantly, retain our on-call firefighters. And that hasn't changed. We're recruiting constantly for our on-call service, and that's going in the right direction, but still a long way to go. In order to meet these challenges, we had to move away from some very inflexible, rigid, traditional approaches to crewing our appliances, and that's why we developed the approach that the Deputy Chief Fire Officer, Lynn Loosley, will run through in a little while. And as we've gone through this new approach, there's been some added benefits that we've seen our crews suggesting, but also we've seen as part of the trial. We've listened to those that are performing the on-call duty system currently, and we've engaged with them throughout, both in the development stages, but throughout the trial, to make sure we're listening to their voices and we're making sure that their needs are being accounted for. As we discussed at the last meeting, we've designed the approach to make sure that our personnel are at the heart of it. What we didn't want to do is do something to them that didn't meet their needs and actually worked against those objectives that we've set ourselves. We've rigorously scrutinised the trial from the outset and have adapted the trial as we've gone through, listening to the teams all the time. Deputy Chief Fire Officer Lynn Loosley is going to provide an overview. We've got a short presentation just to discuss where we are today, a little bit of a look forward, and then we are happy to take any questions. So I'll hand over to Glenn.
Thank you, Chief Fire Officer, and good evening, everybody. So we have the slides, and I know I've got a colleague here who's going to help guide us through this. Thank you very much. So I wanted to just start with a short reminder for the committee about when we came along to discuss the trial that commenced on the 1st of June. And initially, we started that as a 6-month trial where we were going to carefully monitor progress, events and challenges as we work through this. And as the Chief's just outlined, it is a very different approach to using our on-call firefighters. It's a move away from our traditional crewing model. But the trial's objective was always about improving appliance availability and response times from our on-call firefighters to emergencies. And this came as a result of conversations with our on-call workforce. And they were given a choice whether to progress with the trial or not. And they chose to do so at that point after extensive consultation. Why? Because they know some of the challenges that we have as a fire and rescue service around keeping our on-call appliances available. That's something that is seen nationally across each and every fire and rescue service. And it's a given fact that His Majesty's Inspectorate have identified that a number of those services with on-call firefighters have seen a decline in their availability over time. We've experienced that in Staffordshire. So this was one of a number of different options that we started having discussions with our on-call staff to look at improving the response to the public at their most urgent time of need during an operational emergency incident. And since the trial, along with the other investments that we've put in our on-call staff or systems, we've seen a steady improvement to that availability across the service, which we were starting to see when we came and presented to you last time. So if we could move on, please, to the next slide. So we've spoken, sorry, the next one after that as well. Thank you. So just in terms of context, I want it to be really clear that this does not affect our whole-time firefighters or resource. As the Chief's outlined, the minimum that they will have is 4. A lot of the time they will have 5, sometimes 6 firefighters, and we carefully monitor that. Our full-time firefighters are on guaranteed response who are available all the time from our whole-time stations. For the on-call, it is different. And when we said that we are using them in crews of 3, it is only when they are naturally limited by their own availability to a crew of 3. And that must consist of a trained incident commander, a trained driver, and the third person being a trained firefighter who can demonstrate all of the skills required for firefighting, including wearing of breathing apparatus. And this was the choice that we gave to our crews. And it's a binary choice. That's about using them or not. If they are not used in the traditional way, then they won't be mobilised at all. And the next nearest fully crewed appliance would be the first one that gets to attend the emergency incident as soon as it possibly can. So, when we came on the 7th of September, just a recap of the kind of performance that we were seeing at that point. At that point, our crews of 3 under the trial had attended 172 emergency incidents, and the crews were not reporting any safety concerns at that time. There were some errors around mobilisation, around policy, but realistically, we expected that as we introduced something new, and we knew that there would be some learning from that. And we've taken continual steps to address those as we've gone through the trial period. We knew that some stations would benefit from this system massively, and some of them saw as much as a 30% increase in their own availability and usage as a result of this trial. Others, it was negligible. It all depended on the makeup of each on-call crew. Remember, we've got 30 on-call crews across Staffordshire and Stoke-on-Trent. So each one of those crews is at a different level in terms of its strength, its level of trained firefighters, incident commanders, drivers. So it does create a complexity in trying to get a crew ready to turn out around the clock. The overall average, though, at that time was around about a 12.5 increase in availability, which was better for the public. Our crews told us through the feedback that they told us they felt safe while dealing with the incidents. We were extensively surveying them, getting to give us feedback, officers going out and monitoring as well. So really positive. And members of the committee may recall I discussed 1 or 2 specific examples where a crew of 3 got there first and help to bring an incident under control. Can we move on to the next slide, please? Thank you. So since the conversation with the committee, we've continued to engage with our workforce. Now, HMI, His Majesty's Inspectorate, they tell us that our crews are really confident in putting forward their feedback or any challenges that they have. And the Chief Fire Officer and myself know this from our regular contact with them. So we decided to re-engage with them in November of last year. We put on 4 large focus groups across the entire service, and they were held during November at Leek, here at Newcastle, at Lichfield and Codsall too. And we borrowed from the Commissioner's audit panel. So they're called ETA, and these are members of the public who help to work for the Commissioner for the Police and the Fire Service, and they provide some independent scrutiny of any level of performance within the force or the service. Now, we wanted for them to come in and have a look at the level of engagement, the policies, have a look at the performance and the ends that we were trying to achieve. So they were really a welcome addition. The feedback from those engagement events was overwhelmingly positive. Again, they reaffirmed that they feel safe dealing with those incidents. They recognised that they were achieving quicker response times to incidents, and they recognised that it was enhancing public safety. And they were asked at each of those events, they were asked directly whether they wanted to stop the trial or to keep it going or to bring it in as business as usual. And that was over 100 staff attended in total. So all of that information and a comprehensive review of performance came to the Service Delivery Board, one of our internal governance boards, in December of last year. And that was at the point where we anticipated 6-month trial would be evaluated and a decision made. Now, the board at that point voted unanimously almost for the trial to be extended for a further 12 months. And that was to give it a more rigorous test involving more of our on-board teams. Now, the reason that option was carried forward was because a number of our on-call staff said, I haven't had enough experience and exposure yet from the 6-month period. Can we have more time? And also, can we go to more types of incidents? Because we've been very careful to stick to their feedback and put some limitations on certain incident types. So they wanted to go to different types of incidents. They also, from an operational point of view, came back with some really good ideas about getting more equipment and different equipment available to them, which meant that a 3-person crew could operate more effectively. For example, different type of rescue gear to be used on a road traffic collision when they needed to stabilise or extricate an individual from a car accident, different radios so they could lock the appliance up and work effectively as a crew of 3 during those initial stages of an incident. So we've taken that on board, and the Service Delivery Board agreed to extend that period of the trial so we could gather much more rigorous information and evaluate it. Next slide, please. So the performance as of last week, this was 3-person crews now have attended 437 incidents in total. Obviously, it goes up day by day by a smaller number. Now, the type of incidents is wide-ranging, and for the knowledge of the committee, we've actually got 100 different categories of incidents. So it's a real wide range that we go to. But the top 3 that these crews are attending are all different types of fires, incidents on roadways, obviously including road traffic collisions, and automatic fire alarms, which can be quite a drain on our whole-time teams who have to go and obviously deal with those. And quite often, they're not actually an emergency after all. As it stands, there are no safety concerns identified. Of course, there are still the odd concern that will be raised regarding mobilisation or policy, but again, those are worked through. The average increase from this trial now is sitting around about 11%. And actually, we're really pleased at that. Even though it's gone down from the 12.5, it's showing it's pretty constant from the 3-person crewing, and it's remained there or thereabouts. But the important thing for the service is a recognition that where a 3-person crew is mobilised and actually gets first to the scene of an incident, on average, that's 9 minutes and 45 seconds quicker than the next nearest appliance. You will appreciate the geography of Staffordshire being very rural in certain places. It can make a massive difference getting that three-person crew to the scene first. But importantly, for the committee, I did want to share that we have not stopped our investment around our on-call staff and our systems. And as it stands, if we compare our on-call numbers in terms of headcount and go back a year, we're 23 now, more than we are last year. So we're continuing to attract and retain more, but it is a very steady process. It is complicated, and having 23 more firefighters, which is great, takes a little bit longer. There's a lag in terms of transferring that into availability. You'll appreciate the time it takes to train somebody, not just in terms of the core skills of firefighting, but to become a driver or an incident commander means there's a longer period of time that will take to transfer into improved availability. If we could move on, please. So just in terms of the next steps, I've spoken a lot about the incident times. So with the feedback from our on-call crews about going to more, I've highlighted motorway incidents and prisons as examples. That means a three-person crew from July, so next month, will be able to attend 93% of our incident times. So almost 100, which is really positive. The additional equipment has now been rolled out in part. There's still some additional rescue equipment that is going to take time to roll out, but it's well on the way. And I think we reported last time the service is going to honour its commitment to ensure that it does consult with the public around the way that we use our operational resources in the most efficient way. And we're going to be doing that through the next few months through the development of our community risk management plan. So that'll be developed through the next few months. So that is it in terms of the update, and I'll be more than happy to take any questions, and I'm sure the Chief will. Thank you.
Yes, and I think that gives you a good flavour of what we've looked at during this trial, the scrutiny that we've applied to it. We've also had independent scrutiny through the ethics, transparency and audit panel by the commissioners Glyn's alluded to. But most importantly, we've been listening to our communities and our workforce and making sure that we're using our resources in the most effective and efficient manner. And as I said, HMI are looking at us. We've just come out of another inspection and we'll get our full report at the end of the summer. I'm sure this will be part of that full report, kind of back end of August, early September. So happy to take any questions.
Right, thank you very much. Let's start with Councillor Wilden.
Thank you very much, both of you, for a fulsome and very detailed report, with all the I's dotted and T's crossed. You mentioned about a training for on-call staff, and is that standardised? Is it available? Is it incentivised that they do it? And if you've got that training schedule, because one of the things you said was they must be trained and did you say qualified as well? One of the things that you got as feedback, this is so if this is like little B to the question, was that they were asking for more experience. Is there a possibility of tying into the training some form of job shadowing, whereby because you've got a 3-man team who can actually take care of the incidents, you could actually have a job shadowing so that they're gaining hypothetical experience before they actually go into the fray themselves? Just a thought.
Yes, thanks, Councillor Wield, and I'll get Glyn to just cover off the second part of that question. But we make sure that all training opportunities are open to everybody, and it's the 3-person crew because we do have male and female firefighters, as you'll be aware, and we make sure that we're listening to their needs. So as Glyn said, when we went out for those open sessions, you know, some of the firefighters and the on-call teams had the experience of going out in a 3-person crew, but many of them hadn't, because they'd either been on 4 or 5 riders and they hadn't had the opportunity to experience or see any gaps within their training. But some of the benefits that we've seen by running the 3-person crew, and then Glenn can cover it in detail, people who aren't quite at that competent level traditionally wouldn't have been able to go out onto the incident ground, but now they can go out as part of the 3-person crew. So although for the figures, it might say 3-person crew, we might have 4, 5 or 6 people.
Okay, so that's
on
your
that. Yes, and that's the shadowing bit. But Glenn, I'm sure you can cover the detail.
Yeah, thank you very much, Chief. So the training for our on-call staff is standardised, and it does take time because it's often done in modules because our on-call staff have often got other jobs, other commitments as well. So rather than train them the way we would a whole-time firefighter, which is a 16-week process, we have to take a different approach. But we've learned and adapted, and much of it is now localised at their local station rather than coming centrally to a headquarters, for example. And as Rob says, there's been some unintended benefits that we've now seen, whereby if we get brand new firefighters who do a level of training, but don't, for example, get training wearing breathing apparatus, they can go to incidents, but they wouldn't be counted on the system for immobilisation. So now that we can send a 3-person crew out, incident commander, drive it, fully qualified breathing apparatus wear it, there's often one or another one who can now go out and learn, and they are exposing. And it's not just good for building confidence and competence, it's good for morale. And that is the reason that they have often joined fire service, to get out and attend incidents and support their communities. So that's what we're seeing as well.
The way that you've worked this through with the training and, sorry, Chair,
Yeah, go ahead.
I'm on a roll here. The way you've worked it through with the training and the job shadowing, I would call it, it seems to me that you've got a very good template that you could actually inflict on others to help them across other boroughs, other counties and so on. So well done, thank you.
Councillor Fox, yeah.
Thanks, Chair. I have initially 4 questions based on the presentation that was given. So it's been stated that the trial aims to improve availability and response time to the public. Indeed, I think that was something that you assured the committee back in September that was being seen here in Newcastle. Yet some data that's been supplied to us tonight, which I believe is publicly available on the internet, and it's the service's response to a freedom of information request. It shows that since the introduction of that trial, availability in Newcastle has got worse, and indeed attendance times have trebled. And you also state that whole-time crews are guaranteed to be available, yet the freedom of information also shows that that isn't the case. Can you just explain those 2 bits?
Yeah. Yeah, so as we stated at the last committee meeting, we have had some significant issues with on-call availability at Newcastle. There's a significant investigation following some inappropriate behaviours that took place. We had to go through appropriate disciplinary process with that, and we had to dismiss a number of firefighters. And when we dismiss a number of firefighters, we can't just replace them very quickly. It takes time, and we're still going through that process at the moment. And as Glenn said, that process takes a significant amount of time when it's an on-call group of people that we're trying to build up. We have definitely seen a decrease in Newcastle. The figures in the presentation is covering the whole of the county, not just focusing on Newcastle. But we have had some other issues in other parts of the county as well. But I do have to say, on the opposite side to that, some places have seen some really good improvements in availability. So Womble was on 99% availability, Longton was on 95% availability, Lichfield between 8 and 8 was 98% availability. And we've got 6 other stations that are on 70 and 80% availability. So although we've had some negative aspects that we're working through, across the board we are seeing a positive impact of the trial. I think the report on the whole time appliances is around downtime for when the appliance is off the run for servicing, defective equipment, etc. But I'm sure Glenn's got the detail.
Thanks, Chief. So, I mean, just to add to that, Newcastle has got its issues, as the Chief outlined, and we're working really hard to improve the on-call availability there. The whole time system though at Newcastle is extremely effective as we would expect. So whereas we're speaking about the overall increase in on-call availability, that's service-wide. And Abbott's Bromley is an example, that's at the 30% end of the spectrum for improvement. Newcastle, unfortunately, due to the issue around numbers and competency, the crew there is at the lower end. So the 11, 12 is obviously somewhere in the middle. But the point I wanted to make, Chief, is the passion that our on-call teams put into trying to give the best availability for their communities. And only recently they were absolutely affronted because there was a data breach that was extremely misleading that shared that their availability for a particular weekend was really poor. And it was misleading because it led people to believe that one, there was no whole time of it, but also that was factual for the weekend as it happened. It wasn't. That was an internal tool that we look at days before every weekend to identify gaps so that the teams then can work really hard to try and plug them and increase availability. So we dealt with that internally, but the on-call staff themselves obviously contacting the chief and myself about that. So, you know, I just wanted to convey the passion and commitment from each and every one of our on-call firefighters. It's something that we hold dear. So we are trying to work as hard as we can to support that, to make sure that that continues to improve. And Newcastle will improve. It just takes time. Thank you.
Thank you. Boxer, if you want to respond to that, do you want to do your second question, then we'll get some other councillors in, then we'll come back and do your other ones. Thank you.
Yeah, that's fine. Thank you, Chair. Thank you for the response. The presentation states that given that the introduction of a three-person crew is a binary choice. So essentially, it's 3 persons or nothing. However, that's not the case, is it? Because you could merge crews or to run. You could use peripatetic crewing. You could detach surplus whole-time staff, and you could use overtime to backfill the deficiencies. So it's not a binary choice, is it?
I think the point about a binary choice is it's a binary choice when you've exhausted all of those other options, and we have been doing that for many, many years. So we either have exhausted all of those options and then it does become a binary choice. And we've got 3 professional, fully trained firefighters that are capable of going and making an intervention at an incident, or we can wait another 9 minutes, 45 seconds for the next nearest appliance to attend. Now, in terms of service to the public, I see that as the most important thing to do. As we know, 5 people can turn out to an incident and can't deal with it in its entirety. But what they can do is start making interventions to make sure the community has the best possible service that they can get. And hopefully we save life and we save property. So I think that's where the Deputy Chief was alluding to, whereas meaning it's a binary choice.
And if I could just add to that. And so the context around that is the choice to the on-call staff. They've got the choice to either respond as a 3-person crew or not. These were the conversations that we've had. If they told the chief and myself that they weren't happy, they didn't think the policies were sufficient, they didn't feel safe, then of course we would listen. But overwhelmingly, the response has been positive that they want to do that. So that was the context surrounding that, in addition to what the chief said. Thank you.
Thank you, Councillor Northcott.
Thank you, Chair, and thank you very much for this information. I think it's really commendable work you're really doing. My 2 quick questions are as follows. Are you getting a sense of feeling in regard to the Service Delivery Board have voted to extend the trial for any further 12 months? Are you getting the feeling that the model that's coming out of this is a one-size-fits-all, or are you getting one for the rural area, one for the more urban areas, or are you saying it's better to have a bespoke protocol for each individual fire station? The second one is, how much work are you doing in terms of the cross-border arrangements in terms of other counties and their fire crews and their attendants, and how that fits in with shouts, etc.? Thank you, Chairman.
Thank you, Councillor. So in terms of, is it a one-size-fits-all approach? I think that's where the traditional approaches have been, and we've seen the inflexibility that creates and the impact that creates to the service that we deliver to our communities. So I think what we have to do is be as flexible as we can with our resources that we have available. And as Councillor Fox has just rightly suggested, bringing crews together, we're doing that, particularly in the south of the county, where there might be 2 available at one station at 3, at another one we'll bring them together and mobilise them as a 5. So I wouldn't say it's a one size fits all. I definitely think that there are options that we need to always be open to exploring in a controlled way that we're doing it, with the scrutiny applied to it, to make sure the safety of our firefighters is of paramount importance and the service that we deliver to the communities is as high as we can possibly make it.
Chair, can I just add to?
course, yeah.
Sorry, thank you. So as the chief said, about the modelling, it needs to be consistent for our fire control operators so that they can understand what the super got. There is some flexibility, but consistency is important. And it's the same with cross-border as well. So, for example, the West Midlands Fire Service, one of our neighbours, they often send crews of 3 to incidents within West Midlands and over to us. So it's in its infancy, though, about the way we're using it. And at the moment, we're not sending crews of 3 over the borders into our neighbouring service. But again, that is something that could develop out of it. But the other thing that we've also maximised the use of is not just sending them, if you like, to an initial attendance, but to bolster our crews at larger incidents. For example, we've had 2, unusually, we've had 2 major incidents over recent months, one at Hanley, one at Canning. There was a number of crews of 3 that were mobilised as sort of the 6th, 7th or 10th pump onto those incidents to get that additional personnel to help work to bring those incidents under control. So really valuable in that respect too. Thank you.
Thank you. No problem. Thanks.
Thank you. Councillor Rees.
Hi, thanks for your report and thanks for coming again. I just wanted to ask, is working on a smaller crew harder on a firefighters have? I'm thinking in terms of residential scenarios and higher risk situations, stress, anxiety, physical. But the reason I'm asking that, because I've had some stats around firefighters are dying from heart attack at 5 times the rate of the general public. I'm wondering whether you do kind of health checks, regular health checks, or kind of even increased health checks, certainly around kind of 3-man crews.
Yeah. So our approach to wellbeing is at the highest level we can have it, and those regular fitness assessments have to be passed on an annual basis. And if they don't pass those, and that includes blood pressure testing, we do kind of it's called a VO2 max test and make sure that they're at a level to be able to undertake the very strenuous activities that are often part of an operational incident. I think we can go further than that, and obviously with our joint occupational health team, we're looking at how we can improve health screening for a number of reasons, and there's a big programme particularly around contaminants. But coming back to the 3-person trial, then obviously we listen to the feedback. We've got incident commanders there, we've got tactical advisors there that make sure they are on top of the wellbeing of the firefighters all of the time. And as Glenn said, we've got a culture whereby people are really happy to raise a concern, raise an issue. We're not a draconian service that runs on hierarchy. It isn't, it's command and control on the incident ground, but outside of the incident ground, the culture of asking questions and raising concerns is very, very prevalent.
Thank you. Councillor Neeson.
Thank you, Chair. I'd like to say thank you as well, Rob, for 2 very informative presentations, particularly with the updates of the 3-man trial. I think it's been quite interesting that there's been a gap between them, so we've had the honest update on what's going on, and I think it's been very transparent. And I think, particularly from my point of view, that scrutiny members here will benefit from that. I just wonder, and I don't know, Chair, whether this is an idea, I wonder whether scrutiny members may benefit from a visit to the fire station to see how Newcastle sets up possible in its own call team. I did that some time ago, and it was very interesting.
Yes, I think that's certainly something that members are interested in, that we could try and set up. Yeah, I'm sure Steve wants that as well.
Yeah, there's no problem at all, and not just around the 3-person crewing, but in terms of the whole time team at Newcastle as well. it'd be really good for you to see that. We've also got a team that's working out in Newcastle now that's doing a lot of work with our health colleagues around the home from hospital service that's been developed in collaboration with the integrated care board. So it'd be good for committee members to have a look at that and discuss how we've developed those programmes to look at sustaining the fire and rescue service long into the future.
Yeah, sure. Just a quick one, because I caution members against using terminology like three-man crew. We have hundreds of female firefighters in the fire and rescue service. Thank you.
Thank you, councillor. We'll go councillor Jones and we'll come back to you.
Thank you very much, Chair. Thanks again for coming back. I really do appreciate that. I think last time round I had my concerns were centred around a 3 firefighter crew attending a RTA where an extraction was needed or where there would be deployment of breathing apparatus. And I might have missed it when you were presenting this, but I'm sure I hear that you were looking at modelling out 3 crew for breathing apparatus. And I wondered if you just talk me through both of those scenarios and what the 3 crew are doing then.
Okay, thank you very much, councillor. So in terms of the policy and incident times, a 3-person crew will not be sent on the initial attendance. So that's the first pump attending to where there's a house fire and there is known to be persons trapped. However, once pumps are in attendance, they could be sent onto that incident as the 3rd or the 4th to assist in terms of the firefighting operations. So that's still the case because our on-board crews recognise that you would need 2 breathing apparatus whereas to be deployed to effect the rescues straight away. So there's a concern around safety there. In terms of road traffic collisions, 3-person crews are on the initial attendance, and the feedback that we've had is that they are happy to do that and they are making life-saving interventions, even closing the road, sending messages about the location, the type of casualties, the numbers, performing first aid, stabilising a vehicle. And one of the big things they were asking for was battery-powered heavy rescue gear. So things that they can use to make cuts and start to make space to effect a rescue. So they're really keen on doing that and they recognise that they're making life-saving interventions. Thank you.
Thank you, councillor Foxy.
Thank you, Chair. You previously said that you consulted staff who said that they felt safe. I just wanted to query, is it not the case recently that at an incident owing to insufficient crewing, a member of the public had to actually assist in putting a ladder up to a property fire? Because that's in 22 years in the fire sector, I've never known that happen in any fire service that I'm aware of. Just wondering, is that feedback accurate?
That feedback's completely inaccurate. There's been a full investigation into that, and actually the outcome of that investigation will be presented quite soon. So yes, I would be concerned, councillor, if that was the case as well.
Thank you, councillor Foxy. Another question?
Thank you. Just going on to the answer you just gave previously, I'm not sure if it was the terminology has been previously used, it's a little bit confusing. You previously said, Secretary Chief, that 3 persons have fed back that new equipment would be useful, for example, to extricate a casualty at an RTC. So just to be clear, 3 persons cannot extricate a casualty at an RTC, can they?
So 3 persons crewing, in terms of the feedback for road traffic collisions, you wanted some different stabilisation equipment, and I appreciate the councillor, you'll know more detail than other committee members here. So we've spoken about getting that sorted and we've rolled that out now to every on-call team. But they want the battery-powered cutting gear because at the moment our whole-time crews have got that. They want that for a number of reasons. It's easier to operate, it's lighter, there's less of a risk to those individuals because you're not reliant upon hydraulic hose and a big generator, but they can make initial cuts and effect. So we're not suggesting that 3 people in by themselves can fully resolve the incident, but they can make quick interventions to start that incident rolling. So it's a quicker resolution for the casualty who's at the heart of this. And obviously it's better to get them out of the car or save their life as soon as we possibly can.
Okay, councillor Wilson.
Am I the last?
I believe so. Does anyone else wants a question afterwards? I think you're the last.
Oh, good, I like to have the last word. I cannot tell you how in awe I am of what you've done and the progress you've made. It's to be applauded loud and long. Can a 3-man crew get someone out of an RTC? I thank with all my heart the crew that cut me out of a road traffic collision when I had a broken back. Without those young men who joked with me and were quite mischievous and made me giggle when I was in dire straits. That goes with the turf. It isn't all downside of trading. There has to be some humanity attached to it. And I think with any uniformed services, especially the fire and ambulance service, that's a key skill that they also need to learn. I cannot thank you enough, and well done you for doing what you do. Thank you so much.
All right, if there's any more questions, I think it's just for us to thank our commission. Yeah.
Chair, thank you. Thanks to the Chief and Deputy for taking us through the detail there. I wonder if I might just bring something to your attention and get some feedback from members. This is related to the data breach that the Deputy mentioned. There's some information that was distributed in Newcastle, initially distributed by a member of your council, this committee. By someone who probably understood that it was data that had been collected as part of the breach. It was also distributed around other areas in Staffordshire. And my concern is, particularly members of councils and members of scrutiny committees that's looking at the health and well-being of the community, should almost be held to a higher standard in checking and qualifying the nature of what they're distributing before doing so. I was quite concerned that that happened, because the impact will be, to a lesser degree, of concern to me, a loss of confidence in the service, but certainly a risk that the public become afraid or worried about service they're receiving. I think if that happens in the future, everybody should just consider exactly what they're doing and use our antennae as public representatives to say, hold on, is this absolutely accurate? And is what I'm doing a positive thing for the community? And if it isn't, perhaps step back, double, triple check what's being distributed. So the other side of that is that because it was as a result of a data breach, there may well be individuals in the organisation who have to be disciplined, taken through misconduct procedures, or maybe even lose their job. And in any way encouraging individuals to spread information that is incorrect, it's not in the interests of the service either for those individuals. So on 2 or 3 fronts, I was really quite disturbed to see this information being distributed. Now, I have spoken to some people who then forward it on, who have an interest possibly in doing so during the election period. And they were quite alarmed to have been fed information that was, if you like, not correctly put their attention and was not accurate. So I just wanted to put that on record at this committee, because it's about health and wellbeing, it's about safety of the community. And actually, if you're in a position to know better, you shouldn't do
it. Thank you, Bishop. I think that's a very important statement. I think we'll now thank our Chief Officer, Deputy Chief Officer, and the Commissioner for their time this evening. Thank you for coming back to us. Really appreciate that and updating us on the trial. Hopefully, I'll see you again. And yes, we definitely should arrange a visit, come and see our fire station, how our local fire services work, and just pass on our thanks to everyone who works in the fire service for us. Thank you very much.
Thank you, Chair.
Thank you.
Thank you.
Thank you.
Thank you.
Okay, so we will look at item 8, which is the work programme on pages 45 to 46. Okay, so this evening we've got the meeting, water quarry updates, mobile multifunctional team, the scope and purpose, we've got the annual welfare strategy from what was agreed at whole council. Is there any other comments or things for the work programme? Thanks. Councillor Rees.
Can you just bring attention to the under the head of special recently A53 bus gate? That's from the former MP Aaron Bowles, just a while about the Newcastle Borough Council and City Council have been given the go ahead to develop an alternative plan involving City Council purchasing 10 homes along the most political stretch after the ban in the Stoke side. That is good news. First I've heard about it, and it's left in later online. Yet at this committee, since I became an elected councillor, we've been asking continuously for an update and clarity on this. It's always getting kind of kicked into the long grass. Yet why council development we found that as a courtesy in the form of this, before, because residents have been asking me about this. When I'm out and about, what's the update? I don't know, I haven't got any news. And then we read it in a letter from Aaron Bell and later, on Stoke Online.
Councillor Woods is about this issue.
Yeah.
Yeah.
I'll step in because this is your first night as chair.
Go ahead.
That was the first that I heard of it as well. So it hasn't been kept from you. It definitely wasn't a bit of come forward with right forward. But that was the first time I heard from it as well.
But my point is, it should be, shouldn't it really?
Well, it's up to the hierarchy that are higher than us, isn't it? I've got no control over them.
Yeah.
That's 20%.
All I can say is that, as I understand, it's a proposal, and until we get something concrete, as soon as we do, we'll definitely be discussing this committee. But at the moment, I think there's nothing concrete that we can work with. So as soon as we get something, share it with the committee. But as Councillor Wood said, that's the first we've heard it so far. Any other items to raise? Councillor Foxy.
Just on that, Chair, the first we did of it, but even the council gave a quote and press about it, found plans. So it was the first council doing that, if he's given that quote supporting it.
I'm just stating as councillor, myself and Councillor Wood, that's the first we've heard it, but
So the leader didn't tell you.
any comments on the work programme? Councillor Wilden?
The only thing I know about Busgate is that's something that's come up and been mentioned in full council as to whether it's going to be or whether it's not going to be, and it's still open for debate and nothing's been decided. So I don't think anyone can be affronted or hurt or harmed by it because it's still something that's in abeyance and has got to be discussed. So that's a good thing, surely, I would have thought.
Yeah, and as soon as we have more, we'll bring it to this committee. Councillor Jones.
Yes, Chair, there seems to be a little bit of ambiguity about this. I just wondered if the deputy leader had any comments.
Yeah, I did want to add. Obviously, it's been over by Stoke, the houses in Stoke. There was a delay caused because you can't really get policies sort of things until people in the houses know about it. That was one. Second, we were working with the Secretary of State to agree that this was a better outcome. Stretchy Busgate, we finally agreed. Which is when you got that letter. That's what and it's a fact. Now it's not some the Busgate might still be going on, the Busgate's dead. It's fine, these houses. And that's away to the Secretary of State saying, yes, that's acceptable, we can deal with it, that's fine.
Okay. Any other comments or things for the work programme? No? Okay. Well, in that case, we can go on to item 9, public question time. I'm not made aware of any questions submitted. So item 10, urgent business, which I'm not aware of any urgent business. So item 11, date of next meeting is, I believe, 16th of September. 2024. And all that remains is to, sorry, September, yes, 16th September. So all that remains is to declare the meeting closed. Thank you very much.
Stephen. Thanks. That was a nice video. That's what it's also true.
I can see something. You're all eBay. I can see your right sound as well. I'm sure it's just.